Good afternoon, the coordinator, my supervisor, and my colleagues. I'm a student of Texila American University, and I run my course in the Masters of Clinical Research. I did my research work on rectal cancer, its causes, and risk factor in the society as related to Nigeria. What is rectal cancer? Rectal cancer is a disease in which malignant cells form in the disease of the rectum. The definition is broad as it means any blood passed rectally. Consequently, the blood may come from any area of the structure in the gastrointestinal tract that allows blood to leak into the gastrointestinal lumen. The rectum. The rectum is the part of the body where the digestive system takes in nutrients from food and help pass waste products out of the body. The digestive system made up of the esophagus, stomach, and the small and large intestine. The large intestine, that the colon, is the first part of the large intestine and is about 5 feet long. Together, the rectum and the anal canal makes up of the last part of the large intestine and are 6 to 8 inches long. The anal canal ends at the anus. The aim of this research work is to lay emphasis on the causes of rectal cancer and the risk factor, and the study is to determine the rapid growth of the rectal cancer. The rectal cancer incidence was negligibly before 1,900 incidents of rectal cancer and has been rising dramatically following economic developments and industrialization. Currently, colorectal cancer is the third leading causes of the cancer death in both male and female in the United States. The rectal cancer, the initial evaluation, colposcopy. Number 1 is colposcopy, 2 is biopsy of the lesion, histopathologic review. We have metastatic evaluation, chest, abdomen, pelvic CT scan, CEL level, liver functioning tests, endorectal ultrasound or endorectal or pelvic MR, PET scan, not routinely indicated. Pathophysiology, the mucosa is the large intestine regulates and regenerates approximately every 6 days. Krebs cell migrates from the base of the Krebs to cervix. Hello? Cervix, where they undergo differentiation.
Hello, Miss Christianah. Hello.
Hello?
Move the slides,
Yes.
please. You can move the slides. Use the arrow button down. Hello. Use the up
Hello?
and down. Yeah, Miss Christianah, use the up and down arrow, which is at the bottom of the screen.
I should use what? Use what?
Please, yeah, move your slides. You can move your slides of your own. You're still in the first slide. Hello.
It's not showing. Hello, ma.
Below, you can see the, arrow button. Can you see it down? Or use a scroller, not a problem. Use your mouse. Use your mouse.
My mouse, okay?
And scroll it up. Your slide is not moving.
It's not moving.
Yeah, you.
It's not showing.
Yeah, it's not showing. Yeah,
Okay.
that's right. Okay, carry on. Continue.
Okay, thank you, ma. Okay, okay. Ehen. The okay, it's not. The mucosa in the large intestine regenerates approximately every 6 days, and Krebs cell migrates from the base of the Krebs to the surface, where they undergo differentiation and maturation, and ultimately lose the ability to replicate. The significant portion of colorectal carcinoma are adenocarcinomas. The adenoma carcinoma subsequence is well described in medical literature. Colonic adenomas precede adenocarcinoma. Approximately 1% of adenoma will eventually develop into adenocarcinoma. Sorry. The rectal symptoms. In the early stage of the diseases, the rectal cancer symptoms may be minimal or not present at all. As the disease progresses, symptoms may increase in quality and degree of severity, become colorectal cancer symptoms often do not present themselves. The disease progress past the initial state. The signs of the rectal cancer includes a change in bowel habits or blood in the stool. The symptoms may be caused by rectal cancer or by other conditions. The following symptoms might be present in the patient with rectal cancer: blood, either bright red or very dark in the stool; a change in bowel habits; diarrhea, constipation, feeling that the bowel does not empty completely; stool that are narrow or are usual. The general abdominal discomfort, frequent gas pain, bloating, fullness or cramps, change in appetite, weight loss for no reason. Sorry, next page. The diagram. The rectum is the part of the body digestive system. The digestive system takes in nutrients, fat, protein. The lower gastrointestinal anatomy, you can see, as I've earlier said, that the digestive system, that the lower gastrointestinal anatomy, okay, consists of esophagus, liver, esophagus, we have stomach here, and the small intestine and anus. Anatomy of the lower digestive system is showing the colon and other organs. Age and family history can affect the risk of the rectal cancer. Anything that increases your chance of getting a disease is called a risk. Having a risk does not mean that you will get cancer. Not having risk factor does not mean that you will not get cancer. Talk with your physician if you think you may be at risk. The following are possible risk factors for rectal cancer: being age 50 upward, having certain hereditary conditions such as family adenomatous polyposis. Tests used to diagnose rectal cancer: we have physical examination and history, and examination of the body to check the general signs of health, including checking for signs of diseases such as lumps or anything else that seems usually. A history of the patient's health habits and past illness and treatment will also be taken. Digital rectal examination and also coloscopy. Diagnosis: perform physical examination with specific attention to the size and location of the rectal tumor, in addition to possible metastatic lesion, including enlarged lumps, lymph nodes, or hepatomegaly. In addition, evaluation reminding of this colon. Examination includes routine laboratory study in patients with suspected rectal cancer, include the following. We have complete blood count, serum, chemistry, liver and renal functioning tests, and other ones. Rectal cancer diagnosis, treatments. The rectal cancer experts use state-of-the-art diagnostics too, including advanced imaging and laboratory tests to evaluate rectal cancer. This diagnosis evaluation takes about 3 to 5 days. Then together we develop a comprehensive rectal cancer treatment plan that work for individual. The surveillance results rectal cancer. Information regarding the survival results of the patients with distance. Rectal cancer who were diagnosed and at least initial partly treated to help patients decide where to go for treatment, as part of many other factors that may be considering. Therefore, ask an independent biostatistician to analyze the survival results to rectal cancer patients. The chart below shows the cancer survival rate for a group of 362 metastatic rectal cancer patients who are diagnosed between 2000 and 2011. Each patient in the group was first diagnosed. Here we can see the diagram. The survival analysis. At cancer treatment, it was understood that you may also wish to see the survival rate of the group of metastatic rectal cancer patients reported in the surveillance, epidemiology, and end results. Database of the National Cancer Institute is the source of the population-based information about cancer incidence.
Hello, Christianah. Hello, Christianah.
Yes, ma.
Yeah, you got another 3 more minutes to complete.
2 minutes.
Hello. 3 more minutes. Okay.
3 more minutes. Okay. In the case of metastatic rectal cancer, 50% of CTCA patients who were diagnosed between 20,000 and 2011 and or at least initial partially treated survived 1.5 years after the initial diagnosis, while 53% of the metastatic rectal cancer patients survived for at least the lung. Conclusion: a multidisciplinary approach that includes the colorectal surgery, medical oncology, and radiation oncology is required for optimal treatment of patients with rectal cancer. Surgical techniques used to radiotherapy and method of administering chemotherapy an important factor. Strong consideration should be given to the intent of the surgery, possible functional outcome, and preservation of an anal consistent and gastrourinary infection. The first steps involves achievement of cure. Because of the risk-perfect recurrence high in the patients with rectal cancer, and locally recurrent rectal cancer has a poor prognosis. Rectal cancer patients self-report their symptoms and quality of life interferences issue. Using the symptoms assessment tools that patients are invited to complete throughout their treatment. Findings from those assessments are used in creating personalized care plan. Thank you for listening.